This mid-table is about central nervous system drugs, mostly depressants and muscle relaxants, and anti-epileptic and anti-Parkinson's drugs. In this table, I want you to focus on barbiturates, benzos, and muscle relaxants. So if you think of barbiturates, please remember they are more potent than the benzos. They are older type of drugs. They can cause hypnosis. So if a patient is sedated, he's just asleep. But if a patient is hypnotized or maybe put to sleep at a deeper level, interfering with the non-rapid eye movement, that is NREM, then that's going to be more toxic. Do you see that? And this drug has several side effects. Not only can it cause lethargy, decreased cough, apnea, it could also cause decreased REM sleep in the morning, and also potential for abuse, tolerance, and addiction, if you can remember from the opioids. So it's similar to those. Remember, barbiturates are old school. They can be used in low doses and sedative, but then higher doses can cause hypnosis. It can also be used for anticonvulsants, anesthesia, but these drugs are not used as much these days. The way it acts is inhibits GABA. If you look at the mechanism of action, gamma-aminobutyric acid, so thereby inhibiting nerve impulses. It can interact with other opioids, benzos, and alcohol. So as far as nursing implications, one has to be really careful about respiratory depression, drug abuse, dependence, teaching safety with patients, especially when they're operating heavy machinery, and not to mix with alcohol or other drugs that could also depress the central nervous system. As far as benzos, these are more recent drugs than the barbiturates, and they are used not only for sleep, anxiety, also as a sedative, but again in heavier doses it can cause hypnosis. Even though not as common as barbiturates, these are not contributed to death in patients with anxiety or seizures. However, when mixed with other drugs, they could cause toxic effect and death. Example is Michael Jackson, if you guys remember, about I think almost 10 years now. He had high levels of propofol in his body. That was the phenobarbital. And look at those barbiturates. They end with barbital, those class of drugs, right? And then if you look at benzos, they end with PAMs. So going back to Michael Jackson, he had a combination of these two drugs in his system in addition to ephedrine and other drugs. He had a cocktail of these drugs. And if you think about it, they, like I said before, they have high risk for addiction and tolerance, and when mixed with alcohol, they could cause severe life-threatening conditions. Other side effects are just like barbiturates, lethargy, drowsiness, dizziness, and vertigo. Most commonly, if you look at these drugs, the temazepam, the flurazepam, the clonazepam, all these are used for side drugs. Although they can also be used for symptoms of withdrawal to prevent severe withdrawal symptoms in alcoholic patients. The next group is group of drugs or class of drugs is muscle relaxants. You have two types. One is centrally acting, the other is non-central or directly acting. So obviously, if it's centrally acting, it's going to interfere with your central nervous system. That means thought process, lethargy, drowsiness would be more concerning symptoms. Whereas if it's direct, it's not centrally acting, that could be more beneficial. If you look at the types of the names of drugs, you can find that cyclobenzaprine or Flexeril is commonly used when patients have muscle spasms, injury type of injury like muscle injury. So they are centrally acting. Again, you have to be careful about drowsiness, fatigue, and lightheadedness. Whereas if you give medications like metazolone or desanidine, they are not as potent to the central nervous system, so those could cause lesser toxicity in the body, especially in terms of the central nervous system. Mostly given for muscle spasms, multiple sclerosis, and spasticity. These class of drugs also should be used cautiously with alcohol, and teaching should emphasize same things that we do for the other drugs that we talked about. Thank you.